The clinical indication for surgical treatment for tremor patients is for pharmacoresistant patients. This means that the tremor did not respond at least of 2 pharmacological therapies, or the patients could not tolerate the medication. The clinical factors that guide the decision towards a surgical treatment are the severity of the tremor, the phenotype, so the distribution of the tremor, the age of the patients, and comorbidities such as balance and gait impairment, cognitive difficulties. The surgical options available for pharmacoresistant tremor syndromes are deep brain stimulation, MRI-guided focus ultrasound, radiofrequency, and gamma knife stereotactic surgery. The most established and especially used surgery is a deep brain stimulation, where the electrodes are implanted in some part of the brain. For essential tremor, that is most common tremor syndrome, the target is the thalamus. However, the most important clinical indication to take into account is the age, because that is an age limit up to 75-year-old for the patient. MRI-guided focus ultrasound does not have any strict age limit for the inclusion in this surgery, and radiofrequency and gamma knife were very commonly used, especially before the emerging of MRI-guided focus ultrasound. The efficacy is comparable across all these different types of surgery. However, we have longest follow-up. The longest follow-up data that we have is for DBS, radiofrequency and gamma knife, because they have been on the market for longer time. So we don't have an answer in the terms of very long efficacy for MRI-guided focus ultrasound.